thank you to 745. Dr. Kristen Simpson with Simpson Dental Associates is in to take our questions. If you have a question for the doctor, you can call 1-877-924-7888. The number right there, well, it usually comes up on the screen. There it is, right there. All right, so Halloween weekend, this weekend.
Right.
They've got all that candy. It's in a bucket in the newsroom there. Not so good for the teeth.
Exactly.
What can mom and dad do to maybe work around that?
They need to make sure that they're watching the kids and when they're eating the candy. It's okay to eat the candy with meals, of course, after meals, possibly. And stay away from the stickier candies like the taffies and caramel and things like that. More of the milk chocolates and dark chocolates are the ones that are better for your teeth, actually. So just make sure that they're only eating them at meal times, because you don't want to be snacking on them constantly throughout the day, because that sugar exposure on the teeth can make your teeth more susceptible to cavities. So just kind of make sure the kids aren't eating them nonstop.
Nonstop, that's what
yes.
All right, so let's talk maybe for someone a little older. What can you do about receding gums?
Yes, a lot of people notice it normally around like their eye teeth, and they'll see recession there. And you can either, make sure you're using a soft bristled toothbrush, and you might need to have some type of gum grafting done if the recession is too bad. But just talk to your dentist about it, and they'll give you some options.
Let's open the phone lines up. We got a call from Tim. Tim, good morning. What's your question for the doctor?
I had some fillings done on my left side, and every time I chew on that side, when it hits a certain tooth, it gets real sensitive and it hurts really bad.
Okay. Well, a lot of times after you've had a filling done, the bite might need to be adjusted. If the bite's hitting heavy on a certain spot on the filling, it can make the tooth sore. Basically, you have a ligament around the tooth, and that ligament can get inflamed if you're constantly hitting on a high spot there. So it could just be a very minor adjustment that needs to be done to get that tooth comfortable. And sometimes it does take a little while to get used to a new filling. It could even take a couple weeks or so just for the tooth to adjust to the new filling material in the tooth.
Okay, so we'll talk next about what, for someone that may have a tooth that is missing and may not know, what are some of the options to work that?
Right, to replace a missing tooth. Yes, we often see that. Sometimes, people do end up losing teeth, and when they do, they want to know what their options are to replace them. And actually, an implant is, of course, the best option for replacing a missing tooth. It replaces the root of the tooth and preserves the bone in the area, and then also replaces the crown of the tooth. So that would be your best option in the area, and you want to make sure that you would do that pretty soon after you lose the tooth, so that you don't have the shrinking away of the bone height to where you might not have that option later. Another choice would be a bridge. A bridge would connect to the teeth on either side and replace the missing tooth, and it's still a fixed option, which means that it would stay in the mouth all the time. And then another option would be something removable, like a partial. And of course, a partial is something that you take in and out. You should take out at night when you're sleeping. And so those would be some of the options there.
We got a caller from last week, when you were here last week,
yes.
About a woman that was suffered severe anxiety going to the dentist. Is that something you see a lot nowadays?
We do, yes. A lot of people are anxious about coming to the dentist, and it can be a fearful thing if you've had a bad experience in the past. And a lot of times that's what happens with people is, throughout their childhood something happened that was a bad experience, and they can't get over the fear of coming back. But there have just been so many advances in dentistry to make treatments more comfortable, to make sure that you don't feel anything, that the procedures are done more quickly. So lots of ways to keep you comfortable so that you can get the treatment that you need.
All right, Dr. Kristen Simpson, thank you so much for coming in on this Monday morning. Kristen Dental Associates. Coming up next, comedian Chris Rock gets controversial on Saturday Night Live, and what Hollywood heartthrob jammed out with Marilyn Manson on Halloween. That's coming up next in entertainment news. The time is 7:49.